All right. Hey, guys. I'm Rob Tatro, president and founder of the Canadian CMV Foundation and CMV Canada. Great to be here again today on a Thursday morning here in Winnipeg, Manitoba. I'll say sunny Winnipeg, Manitoba. I'm pretty excited here. The CMV Checkup, we're having our first, I should say our second international guest, but our first overseas guest. Really thrilled. I'm going to introduce her right away. Today we have a CMV mom, as well as a trustee for CMV Action UK. I'm bringing in today live from Birmingham, Angela Andrews. Angela, welcome.
Hi, Rob. Thanks for having me.
All right. I tried to pronounce that for you, Birmingham. So you're obviously a CMV Action UK trustee, but you're also a CMV mom. So what does where does the story start with you for CMV, for cytomegalovirus, congenital CMV, the #1 cause of infant disability? How did it start for you?
So I was pregnant with our fourth child in 2018, and my husband had been poorly and had lots of investigations, and they discovered he had CMV. So I was tested during my pregnancy, thinking that we possibly have had it before and it wouldn't be an issue. I tested positive for a primary infection in pregnancy and was told that I probably contracted it between 10 and 14 weeks. So I was transferred to fetal medicine team, who then kept a really close eye on us throughout pregnancy. And we had MRIs in pregnancy and just observations, really, and lots of discussions and decisions about what we wanted to do and how we were to go forward, really. And then our little boy was born at 37 weeks by cesarean section and tested positive then for congenital CMV. He was born. So he had lots of tests, lots of ultrasounds, MRIs, blood tests, urine tests. And look, thankfully for us, I think we're one of the lucky ones. The only thing they found for him was some brain calcifications. And his development at the moment is really good. We're thankful and eagerly awaiting each development milestone. But he's doing really well at the moment. He's failed a couple of hearing tests recently, and we're just waiting for a review on that. But we think that might be more down to other causes rather than hopefully connected with CMV. But how old is
it's George, right?
Yeah, he's 16 months now.
16 months, okay. And sorry, you were a midwife by trade, correct?
Yes, that's right.
So had you seen CMV kind of before?
No, I hadn't at all. And as a midwife, I was completely shocked. And even though we briefly touched on it during our training, it was never something that we talked about after really that much, or something that was I've ever come across any other family. And now, obviously, hindsight's a great thing, isn't it? Because I'm a community midwife, so all contact with all pregnant women, their first contact is always a midwife. So we're in prime position really to be able to raise the awareness about CMV and hand washing, especially if they've got young children or if they work in nurseries, those kind of things. And now it will change my practice, because I will definitely make sure that I can raise that awareness. But beforehand, it was nothing that we ever discussed.
So if you're watching, by the way, on YouTube, please take a second to subscribe to our YouTube channel, a CMV Canada YouTube channel. If you're watching on Facebook, please take a second and like and follow. We'd love to hear your comments. If you're watching wherever you're watching, in North America, in the UK, wherever, please let us know. Give us a hello. We'd love to hear how you're doing. CMV is the #1 cause of infant disability, and a CMV Awareness Month is June every single year. In Canada, we got a whole calendar of activities. What's going on in the CMV UK space with respect to June being Awareness Month?
Yeah, so we're mirroring kind of you guys as well with Awareness Month, and we're doing lots of activities, lots of pushing of information about CMV on social media. We're doing the 5K challenge on the 27th of June, and getting lots of sponsorship in for that as well. You're doing that too. Yeah. So we've posted ours. So my 4 children are going to do our 5K. So as we're all very young, and they've done a little video to raise funds, and they're going to complete it, whether it be hopping, crawling, walking, skipping. So yeah, so we're looking forward to that.
So Angela, that's one thing we both have in common, because I have 4 kids as well, and mine are a little bit older than yours, but we're going to all try to do it as well. It's going to be kicking and screaming perhaps for some of it, but we're going to do it as well. So good for you. Congratulations for doing that.
Thanks. We're also going to, towards the end of the month, light a candle for just in remembrance of babies of CMV as well. So that's something we're going to do right towards the end of the month.
Okay, so a month full of activity over at CMV Action UK. You mentioned that George is now kind of a year and a half, I think. You mentioned that he's doing, I think, relatively good.
Yeah, amazingly. Yeah, we're very, very lucky.
Awesome. I'm so happy to hear that. Has your view on CMV changed, and when did you decide to get involved with CMV Action UK?
Oh yeah, completely. Well, as soon as whilst I was pregnant, I did lots of research into it, and I actually joined as a CMV mom onto the charity website, and then the opportunity came up for a trustee, and I just kind of felt at that point that something needs to be done, and especially from a mom, but also a midwife point of view, you know, the awareness just isn't there. So I just thought I need to do whatever I can. So I applied for the trustee position and was lucky again to get it, and then began late last year. So I'm quite new to the role, but yeah, definitely enjoyed it and trying to get as much awareness out there as I can.
Good for you. Thank you for doing that. Congrats on doing that. Take me through the history of CMV Action UK. For those of you that don't know, the Canadian CMV Foundation started in, well, the first steps were in 2012. Our first event was in 2013, and we got charitable status in 2014. So we're, I guess, relative to you guys, a relatively new organization. Take me through the history of CMV Action UK.
Yeah, so we're a parent-led charity. It was founded by Stan and Faye Courtney, who, following the birth of their daughter Sian, who was severely affected by CMV, and they found there was very little information and little support. So in 1986, they set up a UK CMV association, which was a supporting group for other families, and that continued until 2011. And then in 2011, it was decided that they needed to divide the responsibilities, and that was the birth of CMV Action UK, and a new board of trustees was appointed. There was a new website, an increase in membership and in media interest, and then just this kind of renewed purpose to spread awareness and support families. So at the moment, there's a board of 8 very hands-on trustees. And the day-to-day running is by Sharon Wood. We're completely, majority is funded by community fundraising. So obviously during this current coronavirus pandemic, like everybody else, we've been pretty hard hit, but we're still kind of investigating and implementing ways to continue communication and continue that support with women and families.
Yeah, it's been for sure a different time here lately. I guess that would be very similar to Canada, where in Canada we got a board of very, very active parents. We're completely parent-led as well. We're grassroots parent-led. We do have a medical advisory board that advises us on proper policy, etc. But we also have no funding, just like you guys. Every single dollar that is spent is a donor dollar. So we have that in common, which is really, really neat. I believe I've met Sharon. Sharon, has anyone from CMV Action UK been to any of the conferences in North America, the CMV conferences?
I'm not sure. I'm not sure if they've. We definitely attend lots of conferences. So I'm not sure if in the past it's likely that you may have met Sharon, but she's very involved and she does all the managing of the day-to-day kind of running. So it's quite likely that you will have been in touch with her or in contact with her. Yeah,
we've definitely had some calls at an absolute minimum. I'm trying to think if, do you have any interest in coming, for example, to Ottawa in 2021 for the Public Health and Policy Conference on CMV, on congenital CMV, which is going to be in Ottawa, Canada, which is a fantastic time. You should consider it. It's in August, late August, I think, next year, or September next year.
Absolutely. I think they do look into lots of the conferences and the ones that we can kind of attend and we can get people to go, then that's definitely something to look into, obviously.
Yeah, the 2 big ones are definitely the Public Health Policy Conference and then the Global CMV Conference, which I think you guys hosted, if I'm not mistaken, a few years ago.
Oh,
right?
I'm
It was
I'm
in,
not
yeah, it was in Birmingham, if I'm not mistaken, or in Manchester or somewhere around there. Okay, so you guys have been doing the work. How are things progressing with, like, what are the priorities for CMV Action UK? Is it, I know you're working on awareness. What about screening? What's happening with screening?
So with screening at the moment in the UK, screening doesn't happen really. So with the latest UK National Screening Committee consultation, they kind of concluded from the evidence that there was not substantial evidence to begin screening. So whilst we understood their reasoning behind that, CMV Action have urged to have a multidisciplinary approach to kind of critically evaluate how universal screening can move forward to enable earlier treatment for those that are affected. And we also believe that a 3-year review on the screening is kind of, it's not sufficient, because there's always updated evidence and updated reports which are kind of supporting that screening would be both desirable and cost effective. So our next review here for that is in 2021. But there have been advances as well for in technology, where if babies are failing their neonatal hearing test, then they can get prompt tests and diagnosis for CMV. So some areas, some regions are doing that, and we're kind of lobbying that and supporting it. But it's not a nationwide process yet.
Okay, so I think with the second part there, and we refer to that as targeted screening. So someone who either fails their newborn hearing screening or has potential signs of congenital CMV infection, so microcephaly, a small head, or organ failure, or whatever it may be, they're automatically screened for CMV. Is that's happening in some regions? Like what percentage of the UK is that happening in?
I don't know, to be honest, what the percentage is in. I know within midwifery, within my own role, though, that if there's any pregnant woman has any kind of indications, we do what's the torch screening. So CMV is screened for them. So if you have any kind of growth restrictions or any kind of signs of any serious congenital infections, or unfortunately if there's any stillbirth, then screening is done for all women in that situation.
And you guys are advocating for targeted screening. And then you said universal is kind of something you're also advocating for. For those of you who don't know, in Canada here, our position is universal screening needs to happen. It's cost effective. The seminal study by Dr. Soren Gant, a Canadian, who went and showed that it is cost effective to screen. In other words, as a government, you are putting more dollars in your pocket with a universal screening program. The argument for cost effectiveness, I think, is, or for cost burden, is I think is completely debunked, and it's out the window. So we think it's just a matter of time that universal screening is coming. We're pounding the pavement, advocating. Ontario, one of our 10 provinces, our largest province, is currently doing universal screening for every single baby is being screened at birth. And we're confident that the rest of the provinces will follow through. Or do you think you guys are going to have, like, what's the level of acceptance of that in the UK?
Well, I think we were recently able to join with York University and carried out research into the economic cost of CMV. And from that, based on that, it was the basis of a report that we published, which was called "Counting the Cost of CMV." Now that kind of that reported that it cost £750 million a year, which is a lot of money for a relatively recognised condition or unheard of condition. And 420 million of that falls directly on the NHS and on educational and social services, and then 330 million of it was kind of on, 330 million was on the NHS, 420 million of it relate on like days of loss of work from parents, or them having to privately fund for specialist treatments or specialist equipment. So we're working hard to kind of disseminate all these findings and work with policymakers and health professionals to increase the understanding and improve healthcare, because if we're getting earlier diagnosis, then we can hopefully provide earlier treatment, which would reduce all of these costs.
I would strongly encourage you to take a look at Dr. Gant's study. And if you haven't already, and it's extremely well laid out, and I think it's an extremely strong argument for cost effectiveness. I think there is no argument after you've read the article. So I would encourage you to take a look at it. I believe it was published, I'm thinking last year or perhaps the year before. I think he came up with a number of, I want to say 700,000. I could be wrong on the number. I think it's $700,000 per child that's deaf, a cost on the healthcare system. So as you and I both know, there's a lot of deafness that's created there. What are some of the priorities? I look at your website. You guys have a great website. I could see on here that you guys are having midwives complete online CMV training modules. I think that's really, really, really neat. You have awareness packs. You have training webinars that are reaching professionals. Anything that you're working, I think all that is really, really neat. Anything you want to touch on in there that's happening in the UK, or anything that you're working on in the future with respect to awareness or online activity?
Yeah, so we're still currently working with other projects, and one of them is including one called RaceFit, which is reducing the acquisition of CMV in pregnancy. So the basis of that report was to they're working in line with both pregnant women and families affected by CMV to kind of develop the intervention to prevent acquiring CMV during pregnancy. So we're kind of we're hoping to get the results of that soon and to be able to move on to the second phase. And that is to kind of then show these results and speak to key stakeholders and policymakers, and to obviously to try and move these forwards, to try and to show if there's any evidence gaps, to kind of fill those in, so that in November we can promote the CMV recommendation by the autumn. So this intervention for pregnant women. So we're working on that as well at the moment. We've just started a new family support group on Facebook, which is to kind of let people have a safe place for them to talk. And we're also working with MSD, Congenital CMV National Advisory Board, and they're looking at kind of further research projects and also towards vaccines.
That's fantastic. It's really, really, really neat to see the work you guys are doing. I don't know if you cut out there or not, but I think the work you guys are doing in the UK with respect to CMV is just phenomenal. You guys feel like you're light years ahead of us in terms of advocacy. So congrats for that. If someone wants to learn about you guys, CMV Action on Facebook, CMV Action UK on Twitter, the website is, I'm going to put it up here, www.cmvaction.org.uk. As we all know, June is CMV Awareness Month, so help us spread the word by using the hashtags #CMV Speaks, #StopCMV, and #CMV Awareness. If you're watching on YouTube, please take a second to subscribe. If you're watching on Facebook, take a second to like our page. Anything else, Angela, that you'd like to add with respect to CMV or what someone needs to know out there?
No, I think like the prevalence, I think, and the stats are just they're not accurate, are they? Because we just need to get that screening in place. So, and I think once we know how many children are actually affected by CMV, it would be a more realistic picture. So, I think just trying to push wherever we can any kind of awareness raising, even in nurseries. So when it happened to us, we've got 3 of the young children. They all were in nursery, and I spoke to the nursery about it, and they hadn't even heard about it. And they've got all these young women in there who are obviously exposed quite like all the time. So it's just about raising awareness everywhere, anywhere. Talk to everybody is what I'm trying to do.
Absolutely. So if you know someone who's pregnant or someone who is planning on getting pregnant, please have them talk to their OB. Have them bring it up with them. It is the #1 cause of infant disability. In Canada, it's about 1 in 200 Canadian infants are infected with CMV during pregnancy. That becomes a congenital infection, and one in 5 of those will experience serious disability. Thank you so much for taking the time today. CMV Action UK, Trustee Angela Andrews. Really, really neat what you guys are doing in the UK. Congratulations on all the developments. Congratulations on all the research, on the involvement, on the board, on the trusteeship. Thank you for tuning in today. And thanks to all our viewers for tuning in as well.
Yeah, thank you very much, Rob.
Thanks, guys.